Hello and welcome to our current live session for students in dental medicine and medicine from Varna Medical University. My name is Stephanie Tsikandelova. I'm marketing manager at Inter HECS. If you have some questions regarding the university or the specialties, feel free to ask them below the video. We will answer them at the end of the live session. Hello guys, welcome to the live session. Could you please introduce yourself? What do you study now? Why did you choose Varna Medical University in Bulgaria in general?
Hi, so my name is Maria and I'm from Spain, and one of the main reasons why I chose Varna University is because being able to access medicine in Spain is really complicated, and I thought that going to a small city with nice weather and that gave me the opportunity to study medicine was a good option for me.
Hi, I'm René Alexander Starek from Germany. I'm 23 years old. I'm studying human medicine in Varna. I'm currently enrolled in the 4th year. And I actually came to Varna because I had 3 choices. I could either do nursery and then study medicine in Germany. I could study medicine at a military hospital or go abroad. And I applied to Varna, and Varna was the first, or I applied to multiple universities, but Varna was the first one that replied.
Hello, my name is Lazaros Agouras. I'm from Greece, from Thessaloniki. I'm studying also in Varna, dental faculty. I chose Varna because Bulgaria is near Greece, and I liked the city. I have been several times there, and I think I did the best choice for it.
Hello, my name is Konstantinos Kotsagiorgis. I'm 4th year dentistry student in MU Varna. I decided to study dentistry because I had also a choice. First I studied economics in Germany, but I didn't like it, and after this I wanted to have more communication with patients, and so I came along and chose to study dentistry. So I chose Varna because it's also close to Greece, and yes, the beautiful city, and that's it.
And did you prepare somehow for the upcoming academic year for your relocation to Bulgaria? If you didn't, what would you advise future students to do before coming to Bulgaria?
So me personally, I went to Budapest. There was a pre-med course, and we were taught to study biology and Latin and chemistry, and I always would suggest all students to study a bit biology, chemistry, and the basic medical stuff before beginning to study dentistry or medicine. Yes.
About me, I was studying basically in Slovakia, and I did transfer in 3rd year of my studies in Varna, so I was prepared a bit from Slovakia, but I would suggest people to study biology and chemistry, as my colleague said, as well as some Bulgarian courses, languages, because after 3rd year of studies, you have to communicate with the patients, so it will be helpful for you and for the patient as well to get each other.
I did no extra studies actually before, but as I know, for example, in Germany you currently wait, if you don't have the grade, 6 years before you can study medicine if you're on the waiting list. If you do nursery, sometimes you can enter the university in Germany in 3 years. And these are usually years that you, after high school, don't study as much as before. So I basically entered directly from high school, from making my final exams where I had to study a lot. Directly I entered into medical university, so I was still into studying and didn't get out of this habit of doing daily work, and that also helped me a lot, I think.
Actually, before I did the examination for entering the University of Varna, I already studied before a different degree. So for me, it was more I needed to revise what I studied in high school for biology and chemistry. And I would also really recommend doing these Bulgarian, maybe extra lessons before you enter university, so that you can familiarize yourself with the language, because it's a different language, it's a different culture, and it will really give you the basics to start when you enter first year, and then it's easier, and have normal conversations with people and get into like more the culture, be deeper into the culture than just, I don't know, not really understanding.
I've heard you have Bulgarian lessons in the beginning of each semester, or how is it in dentistry and medicine?
Yeah, we had actually the first 3 years, we have Bulgarian lessons, and
How often?
in first year we had it basically 3 times per week, I think. Yeah, 3 times per week, and also in second year. And in third year, you enter more into the medical terminology. So basically, the first 2 years are for you to be able to speak Bulgarian, like have normal conversations. And the third year is more to know how to make like anamnesis to patients, or to learn the human anatomy, to know the body parts, to know the diseases, how to understand patients mainly, like if they are having pain or all these things.
And yeah, what happens if you like? Is there a test, oral test, or like how do they test your Bulgarian knowledge?
Yes, we have an oral test and we have a written test, and usually multiple choice. And the Bulgarian exams are quite easy. You are prepared well for it. And you can also take extra lessons on the weekend. Also, other universities offer, of course, for money, extra Bulgarian lessons. There are even students that went 2 months, 3 months, even half a year before they started university to Varna. And they learned really well Bulgarian. Like, we had even one student that was half year before in Varna, and he's currently fluent in Bulgarian.
And what happens if you fail this test, or how many times can you sit the test in Bulgarian?
Like, usually you sit exams 3 times. You can retake them.
Okay. What about you guys?
In dentistry, it's exactly the same. But especially for me, that I was transfer student, because I transferred in the third year of my studies, and this session of Bulgarian session, language session, is the first 3 years. I did it in my third year, fourth year, and fifth year, but I did it more intensive. So it helped me a lot, and I did this extra lesson as well, and it was very fine for me. For the patient, I can communicate frequently with the patient. They professors there in dental practice, in everyday practice, they help you a lot, so you don't have any problems on this. So I think it's the same with my colleague.
Okay.
Yes, it's the same.
And what about like lectures? How many lectures? What do you study now? And how was also in your previous years? Because first year students are also interested how first year looks like.
So the first year was like more theoretical. We had like biology, anatomy, chemistry, and we didn't do nothing dental stuff, like to say. We had just like prosthetics, where we had like to wax up some crowns, and actually that was it, and learn something about dental material. But most things were like theoretical stuff, like histology, embryology, and yeah, more medical basic stuff. And after the first year, we had like the anatomy exam, and which was quite difficult. And after the second year, we had like biochemistry exams, physiology, biochemistry, and well, subjects which have nothing to do like with the dentistry actually. But after like the second year, we started like having like the dental subjects more frequently, and that's like where we get like more to do with dentistry stuff. Yeah.
When do you start meeting patients?
We start meeting patients after the third year, in the first semester of the fourth year, and we meet them like in subjects as like conservative dentistry, where we do like endodontic treatments, or like cavities preparations and fillings, and another subject is like surgery, where we extract teeth, and another subject is like periodontology, where we are cleaning the teeth, like treat gingivitis, and yeah, like oral hygiene most. Yeah.
Do you do this in a hospital in the medical university, or in a hospital close? Where do you do this practice?
We do this in the dental faculty It's like a new building. It's I think from 2006. I think yeah, it's best highly equipped for, as I see it. It's very good chairs inside, and the materials are good. And yes, it's very nice. Yeah, we do all the training in the dental faculty for dentistry. Yeah, the other things like medical stuff we share it like in the hospital or like in the university. Yeah.
And what about the fifth and sixth year?
About me, that I'm 6th-year student. Basically, as my colleague said, on the 4th year you are starting visit the patient, and you are getting used to this by 2nd semester. Let's say it's better because you are start doing procedures. On the 1st semester, mostly you visit the patient, you take history, and the professor doing the stuff, and you are watching them. So to get it. After the 2nd semester of the 4th year, you are starting doing your own treatment in all subjects, conservative, periodontology, even prosthetic, like prosthetic restoration, I mean building of crowns, preparation of teeth, and also dentures, or either total or partial dentures. But after in the 5th year, you are doing everything by your own, and they just see what you are doing. If you are doing it correct, you are getting grades and this stuff. So you have to communicate with your patients. That's why I told before it's good to know the Bulgarian language. It will be very helpful for you as well. In the 6th year that I'm now, you are working every day with the patients. You have your own patient list, and you are working only in the university. It's very highly equipped, and it's very nice, the university inside in Varna. And you are sitting for the exams every 2 months. They change the system now. So you have to give 6 state exams, 6 subjects, main clinics, and you are giving it by 2. 2 on December, 2 I gave just right now this week, and 2 on the May. So I think it's nice. The program is nice. You are working a lot with the patient, and you are gaining too much experience on this.
How do you get your diploma? Like, what is the final exam? Or
dental medicine doctor,
yes.
master degree. Yes.
And you need to sit an exam, or what?
Yes, you are sitting on exam. Yes, you have both written and oral questions. You are working in every semester with a patient, and all these grades are collected together, and you're passing the exam.
In general, for dentistry, like in the 1st year, what subjects should a person prioritize?
On the 1st year?
Yeah, during the 1st year. Like,
during the 1st year, as my colleague said, it's more, the same like medicine, biology, chemistry, anatomy, physiology, physics. You are doing this stuff.
Yeah. What would you advise future students to focus on? Because they have a lot of stress, and they don't know what to put the most effort
Yes, I
on.
understood. Better to focus on biology and anatomy, I think. Yes, because it's you will have to work with a human, so it's you will need it for sure. Anatomy is very important thing. Physiology as well, biology. Not that much. I mean chemistry and other subjects. As dental doctor or medical doctor, I think as well. Yes.
So what about you guys? What are the subjects?
Yes, like you have in the first 2 years university, basically, or classes at the Medical University in Varna, and then after, like when you enter the 3rd year, you will be almost only in the Sveta Marina University Hospital. And in the 1st year, a lot of people struggle a bit with biology, chemistry. In the 2nd year, you have the examination for anatomy and biochemistry, which is hard. Of course, it's all theoretically then, and the connection to medicine and with the patients is a bit difficult to see for some people, but it really is the basis. The better you study it, the better, like the easier you will have it in 3rd year. Everything is based on it. And if you focus on anatomy especially and physiology, you will have a great time, especially in 3rd year. And once you enter 3rd year, you enter Sveta Marina Hospital, where you have a lot of patients. You have internal medicine. I think the most difficult exam in the MU Varna in 3rd year is pathology. In 4th year, it's clinical pathology. And Yes, we usually in internal medicine we visit patients. For example, if we have pulmonology, somebody with pneumonia, and we have to do the anamnesis in Bulgarian also, but we can also do it in English. Then we do palpation, percussion, auscultation, and afterwards we discuss it with the teacher. They help us how to make better our anamnesis, how to auscultate better, and we discuss the results.
Yeah, also mainly all the lectures are held in the hospital or in a building that is in front of the hospital or in the Medical University of Varna. So the first 2 years you have most of the lectures in the uni, so you don't have to worry about going anywhere. And it's quite interesting to go because once you are in the lectures, you can always learn better the material that you need to prepare for each seminar. And apart from all these activities, you can always be part of different things, like our university makes every year the symposium, the Black Sea Symposium. So if you're interested in a topic, you can always ask one of the teachers related to this topic. Say you want to do something of anatomy or something on gynecology, something that you like. So you can learn more about this topic and also like get to know the teachers. So maybe in the future you can attend more to do things with them. Like if you're interested in becoming a gynecologist or doing something in surgery, maybe like getting more into all these topics, meeting more the professionals there, and maybe you can see more surgeries or extend your symposium to make even a bigger investigation for whatever it is you would like to do in the future, a PhD or something, who knows. But apart from all our seminars and lectures, you can always be part of these things, and I think it's like a really nice option to learn more and participate more.
And also about your lectures, like, how does your average day look like? Do you have, how much free time do you have? When do your lecture starts? Everything related to your timetable.
Well, actually for us right now in 4th year, and this semester in particular, it's really packed because we have a lot of seminars and a lot of lectures. But normally you have time for everything. You have time to go to the seminars, you have breaks in between, you have lectures, you have time to prepare for all your classes. It's not like you are consuming stress or that you don't have time for anything. Like you have perfect time to manage yourself and to also have free time and to do everything. Like for us, especially just 4th year, I would say this semester is when you have like a lot of lectures and a lot of seminars. But they try to adjust everything in a way that we don't go crazy, or I think they really try to make everything match.
And what do people usually in Varna do in their spare time?
Well, you can do a lot of things actually. You can do sports, or you can meet your friends, have a coffee, go for a walk. You can go to the cinema. You can play bowling. I mean, Varna is a city that is not so big, so you can go walking everywhere and you can do actually a lot of things. And for really nice prices, I think.
Yes, like especially the beach, it's really nice there, the park, having walks, meeting your friends, they all live close to you. So it's really simple to just meet and have a coffee, go to a bar. Varna offers actually everything, almost everything. And it's nice, like a lot of people do sports there. Also Varna University focuses a lot on sports. You, for example, also have sport lessons in 1st and 2nd year, and yes, you have enough time to relax also, because for example when I came to Varna in 1st year, I was really stressed because I thought I need to study so much. I was worried about exams. I was worried that I might be going to fail because I didn't know what I had to expect, how the exam's going to be like. And afterwards I became more relaxed and didn't have so much problems. Basically in the 1st semester I studied only and was only at home, not going out, and yeah, you don't need to stress as much.
And when do your lectures usually start and finish?
Usually you begin at 8 o'clock and maybe come home at 5 or 4. Depends, it really depends. Sometimes your schedule, you even have no classes on a Friday. But therefore, for example, now we have on Tuesday from 8 till 8 o'clock. Therefore, some here only have like 1 hour class or 1.5 hour on a Friday, and that's everything. So it really depends on how your schedule is like.
What about you guys? How is your schedule and free time activities?
My schedule on 6th year now is 3-4 hours a day. You are working by patients, with patients, and happens during the first 30 days, 1 month, approximately 1 month, and then you have no patients to do, and you have to study for the exam. Every day we are working like 3, 4, 5 hours maximum with the patients in the dental faculty, and then you are free. So you have plenty time to do things or to study. This is for the 6th year students, because on the 5th or 4th year students, you have to attend many classes, you have to practice a lot, and basically you start again, as colleague said, around 8 o'clock, and you finish till 6 o'clock in the afternoon, I think. But there are days that you have only 3 or 4 hours university. In Varna you can do many things. It's a very nice city. The weather is very nice most of times. And you can visit the sea garden. It's amazing because in the seaside. And it's very big, very beautiful. It's a safe city. You don't have any problems there with inhabitants and these people, other people. Have many cafes, nightlife. For students that very want to come, it's true this, I'm not saying honestly. And have many other things to do, like sports, as colleague says. You can do everything, I think, in Varna. It's nice to study in Varna. I would
What
suggest
about the
it.
first year of studies? Do you remember how packed was your schedule?
Yes, it was okay. Like we had a lot of lectures about the theoretical stuff, but and a lot of Bulgarian classes. I remember, yes. So it was like quite compact, but we still had like a lot of free time to enjoy our life in Varna. Yes.
Actually, before talking about the fun part, like how was did you have any entrance test for admission at the university?
Yes, we had like to participate at this admission test, and it was like an English part, I remember, and one biology part, one chemistry part, chemistry part, and yeah, but it was quite manageable. It was like nothing too severe, like with a bit studying, we will pass it, yes.
Okay, is it the same for medicine as well? Yeah. And a lot of people are asking in terms of prices, like how much do you usually spend per month? How much is your apartment?
So my apartment is like all included, like with electricity, and it depends. Like in winter, I pay like more because of the heating, but also like in summer, I pay for the air condition. It's like 300 euros, I would say, a month.
1 bedroom or 2 bedroom?
It's 1 bedroom. 1 bedroom, yes, 1 bedroom. And yeah, the expenses are like lower like in the winter, because you obviously can't go out so much because it's like cold, and in the summer like they increase like overall I would say maybe like 500 euros like. Yes.
So what about you guys?
About me, I'm paying for my apartment 350 euros, but it has 2 bedrooms because I'm married and I have child as well. And but it's nice. I think for student, approximately from 200 euros to 300 euros, you can find a very good apartment in Varna. And I mean very good apartment with nice furniture, good building, and near university. For your life, you don't need to take car or to have car there, I think, because taxi is very cheap. With 5 leva, for example, 2.5 euros, you can go everywhere around city. The distances are very close to each other. So the center includes everything like cafe, clubbing, everything you need. To go to the sea garden, it's easy. You can go by walking, you can use transportation, buses, etc. And personally, for my fun and living in Varna, 300 euros more are enough for the month. So hope I helped, I don't know.
So I'm actually living right now in my third apartment because usually in first year a lot of people live close to the medical university. Later they move to the Sveta Marina Hospital because it's then closer. And I live from 450 euros a month. My first apartment I lived with two people. We were three in total, and I paid 130 euros, so it was quite cheap. My second apartment was for me alone, one bedroom apartment, about like 50 square meters, and was 180. And right now I live close to the Sveta Marina Hospital. It costs 200 euros. It's a really nice apartment, really nice, but
Only for you.
only for me. And I'm really happy to be there. If you maybe want to find a cheaper option, you can also go to the students' dormitorium, and it costs there around for foreigners like 50 euros, 60 euros a month to live there.
Is it hard to get a place?
No, it's actually quite easy. Also, if you have troubles, for example, finding an apartment, you can be there, just apply for it. And I think there is no problem to actually get a place in the dormitorium. You just have to ask the student's office. And because, for example, there are also people who have problems with their landlords, they get thrown out maybe and they need to find a place, then they can stay there. But you have a small room with 2 beds, so you sleep basically with another person in one room. But it's nice. It's nice.
So what would you say is the main advantage of a private apartment? Because apparently it costs a lot more.
Yes, the dormitorium, you basically have to check in and check out. You use bathrooms for multiple people, and also on every floor I think is a kitchen. The advantage is that they also have a study room and like a library and computer rooms and a cafeteria inside. But if you live alone, you can really focus on your studies. You have your own shower, your own bathroom, and you can stay up all night, be loud, throw a party, I don't know. But you have privacy, and that's what it's nice. Yeah. And for food, it depends. I pay like 30 euros for food a week. Yeah.
I guess, yes, same for you, or?
Yeah, I would say that I basically live with 500 euros per month approximately, and I include everything there: my food, my going out, my rent, my water, electricity, my phone, my extras, like everything comes from there. And you can find really good apartments for different prices and different areas. I, for example, live around the center, so most of my friends also live there, so I have to go to the hospital a lot, and I can always grab a taxi with them. So it's always going to be cheap. And you also have bus, and the bus is 1 leva. So in terms of transportation, it's actually really accessible.
How much is a taxi usually? How much does it cost?
For example, from the city center to the hospital, it would be like 5 leva or 4 leva.
Like
And you
€2,
divide this, between 2 euros or 2.50 more or less.
Mhm.
And 4 people, so
Just
it's
yeah.
actually cheap.
And finding a private apartment, is it hard to find something close to the university?
Well, actually, I found my first apartment in the internet. I Googled it in Spain. I was at home and I just Googled for apartments, and I found an agency, and I got in contact with them, and I got my first apartment there. And I wouldn't say it's so difficult. I mean, it depends on your expectations or what you are planning to find. But I think it's really feasible. It's something that you can actually manage in Varna.
Yeah.
Also to add about it, usually agencies, you have to pay half of the rent for them to get an apartment. They have really nice apartments, and you can also just enter over Facebook, the medical university. Usually there is the MU Varna marketplace or somewhere where students actually offer their apartments once they pass the semester. They want to move out, they want to go to their home country, and they are asking for new tenants.
Or they do couch surfing as well.
Or couch surfing, yeah.
Some people offer their apartment while they look for something else. You can always.
Are there many international students now at the university?
Yeah, I would say mostly they are all coming from Germany. We also have a big group of British people. And then we have some Spanish, some Greek and Turkish, and some from Sweden I think Finland even, or we had only Swedish. I don't know, but like it is quite international, I would say.
And how do people in Varna speak English? Is it touristic actually because it's at the seaside?
Yeah, I would say it is actually like touristic, like a student city where you will find like a lot of life, and mostly every Bulgarian understands actually English. Like you don't have problems in communicating with anyone. I haven't had like real troubles to communicate with people so far.
Would you all agree? Or
If you go more up to Golden Sands, you will, for example, find a lot of German people. If you go in direction to Nessebar, Sunny Beach, you will find a lot of English people, for example. And currently, they're like the biggest minority in our university are the German students. And also in the lower years, like the first year, it's getting more and more German students actually. But yeah, we try to speak only English to keep this multicultural feeling that we right now have in the university alive.
how about the dental faculty?
In our university, it's more or less the same. It's international university as well. I had to say that to add Polish people from Poland, we have also in my group as well. And about English speaking, it's true all this. It's very easy to communicate with people. It's a touristic place, so they are friendly to you, and most of them they are speaking English. Especially in the city center, they all speaking English. Even the waitress, in the services, yes, it's fine.
How do you actually travel to Varna, like from your home countries?
Personally, I have car. I'm traveling by car, either by Sofia or from the other borders in Greece, in Romania there. The roads are quite good, no problems to travel, but you can take also buses. Many students in my group taking bus, and from Varna to Sofia they have every day, every 2 hours, I think. And it's not very expensive, and it's quite good, the bus, I mean, the transportation.
You can also rent like cars. They start like from 10 euros a day, and that's quite cheap.
10
so
euros per car to rent a car.
Yes, per day, yes. Yes.
Okay,
Yes.
that's cheap.
They start at 10 euros per day. I think it depends on the season. Yeah, when I last rented it was like Easter. It was like 10 euros per day. Yes.
Wow.
Yes.
Okay.
Otherwise, like planes or yeah.
To Varna, straight to Varna, or you have to go to other
Straight
cities?
to Varna. Yes, you can fly either to Sofia and then to Varna.
Okay.
I think Bulgaria flies twice a day, once in the morning, once in the evening, and like a lot of German students like travel from Germany like to Vienna, and then from Vienna to Varna with Austrian Airlines.
And what about you guys? Like, how do you travel?
I usually take Ryanair flights from Sofia. They are the cheapest ones. Usually in summer, because of all the tourists coming, Varna offers also a lot of cheap flights. For example, for 150 euros back and forth or something. But right now, Ryanair is the cheapest one. They offer 50 euro flights to Hamburg, Berlin, even 10 euro flights or 15 euro flights, really cheap ones. So I take the bus via Biomed company or whatever, and they cost around 15 euros. So in total, I'm actually with back and forth about 70 euros to fly to Germany and back.
Cheap, yes.
Yeah.
Also, what a lot of people do is that they go either to Bucharest or to Istanbul, and they also find really cheap flights there. For example, you have from Bucharest to London, like only 20 pounds two ways, for example. Like I had a friend that she's from London and she flies like this. And for Spain, we don't have a lot of combinations actually, but you can also always go to Istanbul and find really cheap flights, or just from Sofia to Madrid, or however, like there are very different ways to travel and that are actually really cheap, I think.
Did you want to mention something? Yeah.
I wanted to add about Bucharest. Many people in my group as well, especially from South Greece or Cyprus, they prefer to go to Bucharest because we are finding cheap and nice flights for these destinations. But it's up to you. You can search on the internet. It's quite easy now. Yeah, that's right.
what is the main thing you like about Varna and Bulgaria? What would you say is the best thing about your studies here?
Personally, what do you mean, in everyday life or in the university, generally?
In general, yeah.
Basically, I have a nice time. I'm 4 years now in Varna, and I have very nice times because the university is really nice. Really, I learned many things because now I will get my diploma this year. I had too much practice, and that's the most important, I think, in dentistry especially. And people are nice in Varna. Varna is nice as a city, and I like the mentality here, the Bulgarian mentality, the Varna as a place. Our professors were helping you a lot, so to don't find any difficulties. I think it's nice. I suggest to study Varna, and especially dentistry. I don't know about medicine, but in dentistry it's very nice, yes. And you have everything, how to say, everything it's near to you. Even for fun, even when university, every subject and every clinic is inside university, everything is included. So it's very nice to study there.
Do you have something specific to add, or does it? Okay.
Like when you go out, like it's basically the half price. Like in Greece, like we pay like double price when we go out, and it's much cheaper. Like going out, you can more frequently go out and enjoy more your life and higher quality. You know, it's for a student. Yes.
And I wanted to add, especially in summer, because it's a touristy place, it's very nice, and you can find people from all around the world, really. And it's beautiful, you know, to go to have fun after your exam session, especially if you passed it and you don't have any subject for September. It's nice to stay there, for example, for 5 or 15 days more, to have like mini holidays there. I think it's that's all.
Yeah, like I always, every day, am grateful to study medicine because I really always wish to study medicine, and Varna gave me that opportunity. And I have a really nice life in Varna for 450 euros, having your own apartment, going out, paying only half the price or 1/4 of what you would normally pay in Germany. That's a luxury. That's really nice. And
I would also want to encourage people not to be scared to go abroad to study, because it's a really nice opportunity to meet new people, to be part of a different culture, especially when you have the option of studying what you really want to do. And our university is really flexible, and they allow us to visit our hometown. We get really nice holidays also in Christmas, when we arrange everything, if possible, you know, like they really try to make us feel comfortable. And when it comes, for example, to theoretical part of our studies, they are really good. The professors are really well educated. You get really good basis, and the rest, of course, depends on you, on what you do and the interest you show in things.
And how are the holidays? Like, when does this academic academic year starts? When does it finish? When do you have holidays?
So normally we begin around the 13th of September, I think, like the second week of September. Mm-hmm. And then we have like these tiny holidays, I think maybe in October. Is it October or November? I don't remember. Like there's like maybe 4 days or 2 days that we have a tiny break. And then for Christmas, if we arrange to take all our seminars before, we can leave like maybe for 3 weeks. And then you have the examination session. You have also the retake session. So like we really have a lot of opportunities to study and pass our exams. Afterwards, we have Eastern, that it's like 4 days. And then we have our summer examination in, I don't know if it's like June, the end of June, beginning of July, more or less. And then you have holidays again until, if you pass everything, until September.
Usually you have in summer 1 month to do an internship, and afterwards you have another 1 month free. And yes, the internship starts in 3rd year.
Do you have to look it yourself for yourself?
You usually have an internship that you do at the Medical University of Varna, but you can also apply for internships in your home country, which might be cheaper, or you just like to do it where your parents live because you, for example, miss them. And those holidays after the internship, they are the most relaxed ones, because actually the holidays that you have over Christmas are before the examination session, so it stresses you a bit that you actually need to learn for the exams in January. But the advantage is that you have more time to study for those exams, so you can do them really well.
Are the holidays?
Yes, it's the same in dentistry. About internship, we are doing. We start to do internship in the third year. You have to do it for 1 month. After for 1.5 months, I think, in the fourth year or fifth year, and you can do it in your countries, in dental offices in our countries. We can do so. You get a confirmation paper, and we give it to secretary of our school. But we did it. It's good to do it, and it's not quite difficult to do this. About holidays, it's exactly the same, I think. Yes.
And in terms of exams, are they like how many exams do you usually have? Are they hard? And if you find a subject hard, like who do you turn to the teacher, or what happens?
Now that I'm 6-year student, I told before that we share it by 2. We have 6 basic clinics, let's say, for whole year, and we share it by 2. But it's the whole dentistry, you know. It's now because you are ending, you are getting your diploma. It's too many things to know, too many things to study. For less year, like 5th, 4th year of dentistry, you have 6 subjects, 4 to 6 subjects every semester, and you have time to study. If you find something difficult, you can tell to the professor to have some extra lessons or some extra lectures, or to give you extra material to study. I don't think you will have problems. If you want to study, you will study.
Yes.
Yes.
And what happens if you fail exam?
If you fail an exam, that's not problem again, because you have retake session. You can sit for exam 3 times, and if you fail again, I think it will be 1 more retake. I think it's like this, yes, right? Yes, I never
But
done
the
it.
retakes are right after the exam session, or the next year, the same time?
I think till third time it's sharing about the dates. It's in the same year, I mean,
Yes.
to don't lose your year.
Yes.
And the retake, the fourth time I think is on September, or third and fourth time is on September. I never have done this, so yes.
Yeah.
But I think rarely you are going third time or fourth time. If you are studying and you are attending the lectures and every day your university, you will not have problems with the examination period. Yes.
And how are the exams with you guys?
Basically, it's exactly the same. You usually have a retake session after the examination session. So you will have, after your exam or after all of your exams, 1 week to study and prepare for the retake session. And then you have 1 retake for the specific subject. And if you don't pass it, you have to usually wait for like 1 semester until you retake it in summer. And yeah, usually like people here pass it or not. And when they don't, they usually go to their teachers. They try to talk to them what they can do better, how to prepare for it. Maybe other students did their summaries, so they can share them. If you study, you pass. And also, of course, the first and the second year are quite hard. They want to find out who can study, who can't. Medicine is a lot of studying by heart. Means you also need to understand, of course, but you really need to know the facts. And that's what they're also trying to test. And once you pass the first semester, the second semester, you get to know better how to learn for those exams, and you will have it a lot easier.
I mean, personally, anyway, you are in university and you decide if you want to study or not. Like, you don't have anyone to be there to tell you, like, study. So, obviously, if you prepare yourself beforehand every day a bit, it will be easier. And for me, personally, I would recommend that, for example, in second year, you have the real big anatomy exam. And you have to, like, realize that anatomy is a lot of things that you need to learn in very few time. So if you leave it for the end, it's going to be really stressful, because in second year you have physiology examination, biochemistry, anatomy, and it's a lot of stuff. So try to, in first year, that you have actually more time to be already preparing, like, for example, for anatomy every day a bit, and it will be way better than if you stress yourself in one examination. And as they already said, there are many possibilities, many options to prepare the exam. So maybe in one go you cannot pass all the exams. So maybe just like schedule yourself and say, I want to pass 4 exams out of 6. You give your best in those 4 exams, and then you try the other 2 in the retake session. Like, there are options.
Also, what is really nice is that we usually have a multiple choice test, a written test, and an oral part. Usually we present in that oral part the written test, and the written topic is read by the professor, and the professor then asks questions about it. And those topics are in the syllabus. So we actually know every topic that we might pick and will be asked to. So actually you can see, for example, in physiology, if there are maybe 200 questions, you can tell, okay, I have 100 days, so that means I need to do at least 2 summaries of those topics a day, and I will be prepared for the exam. So you can do every day something, do your homework, and you will be prepared. And you will have a nice summary to read.
One future applicant is asking, how is like working with patients? Because they speak Bulgarian, so how do you deal with that, with this language barrier?
So in 3rd year, you have always also the Bulgarian anamnesis, how you talk to the patients, what are the organs called, and you usually try to speak Bulgarian to them because of course you want to practice it, but your internal teacher, for example, will be always present, so in case you have questions, in case you want to do it not in Bulgarian, you don't have to. You can also do it perfectly fine in English, and your Bulgarian, like your internal teacher, will translate it. And of course, it's also sometimes difficult to understand the Bulgarian patients. And then just the teacher will translate it. So there won't be any problem. You shouldn't worry about the language. But it's of course always nice to speak it. And yeah, if you spend so much time, like 6 years in a foreign country, would be nice always to learn the language. And of course, I also got told by many doctors that once you apply for a job, for example, me, when I go back to Germany, they would also like to use me as a translator, maybe for Bulgarian patients. Yeah. And this is also an advantage, because once you go back to your home country, maybe they know this person has really good foreign language skills in English or Bulgarian. And this is really well seen.
For our specialty, we're observing patient since 3rd year starting, and you invite the patient sitting in the dental chair. You are taking medical history, and you are doing intraoral and extraoral examination. Professor or assistant, they help you a lot on this, even with the language or with the observation and clinical examination of the patient. So in the 3rd year, they are helping and assisting a lot on you. But from the 4th year and go on, and so on, you are continuing by yourself. So it's not so difficult, and
so the teachers are there to help you.
Yes, every time, because you have to do with a human, so you don't have to do any mistakes. Yes. So every time they are resisting on you, you know. It's yes.
And for both of you, is the whole, like all 6 years taught, like lectures taught in English?
Yes, everything is in English. Yes.
And what degree do you obtain at the end?
It's difficult because I actually know only the German word Staatsexamen. I don't know.
Do you get a
MD.
master's degree? Yeah,
MD.
MD. Okay. Yeah. And
DMD, dental medicine.
Okay.
It's a master degree. It's in Europe, all around Europe.
Yep.
It's the same.
And is there something that people should bear in mind when studying your specialty, like dead bodies, for instance? Like, was there something, or culture shock in Bulgaria? Like, was there something you found particularly hard, or some of your colleagues at the university found hard?
Not hard, but I think it's really important that you keep in mind it's a specialty where you have patient contact. You need to touch them, you need to ask them a lot of things. You also not only know the facts and really learn stuff, but you also have to have social capabilities. So you need to interact with humans, and you need to know how to talk to them, how to start a conversation, how to also really touch people. That's really important because actually a lot of students are scared to touch patients, and that's not good because you really need to learn this. It's really important.
I would say also the first time that you go to a different country, it's going to be hard because of course it's different. You are all by yourself, and it's time for you to be responsible of what you're doing and how you're living and how you adapt mainly. So of course it's going to be like different. It's a different culture, but I think it's really manageable. You will get to know a lot of people that are in the same situation as you. So in the end, you will make really nice bonds and friendships here because they understand actually what you're going through. So if you feel homesick, you can always go back and like visit your family or talk to them through Skype. And like, I don't know, in my personal perception about this, I had a really nice group of people that I met that are in the same situation as me, and they really made me feel comfortable when I am missing home or feeling like sad or something.
In dentistry, you don't have to face any problems on as dead corpses or bodies or stuff like this. Just in the beginning, you are going to see as well an anatomy room and this stuff, or dissection room. But in everyday practice, you have to use on bad smells of the oral cavity of the mouth. Okay, you are wearing masks or gloves, but you have to use on this. Yes, but okay, that's all I think. I don't know.
I guess maybe like for like first time calling like stranger persons, you have like to call them and then speak in foreign language like Bulgarian for us, and it's like difficult like to understand them and like for like beginners, and it's quite funny because they don't understand you, you don't understand them, and yeah. But it's nice, yeah.
And last question, like, what do you plan to study, to do after your studies?
For me personally, I would like to go to Germany and do like after degree in orthodontics. Yes, and after this, like work a little bit, and well, let's see. Yes.
Personally, I will go back in Greece. My father has dental office, and I will work there. And I will see if I will do some postgraduate studies after. Maybe here, because there are options here, I wanted to tell as well to future students, either in Sofia or in Varna University or in Plovdiv University, there are postgraduate studies as well. So it's up to you what you want to study or how to continue.
Yes, I want to also work afterwards in my home country in Germany. And I actually am really interested in cardiothoracics and maybe surgery, maybe internistic, but I had just the feeling that the department of cardiology was really nice, so I learned a lot, I got more into the topic and got interested in cardiology.
That's a really interesting question because right now I really don't know which area I want to specialize on. At the beginning, I had it really clear that I wanted to do neurosurgery because I really like the brain and stuff, but I've seen also other areas that are also really interesting for me, so I really don't know where I will specialize, and I also don't know if I will do it here in Bulgaria or if I want to keep on traveling and doing it somewhere else. So my options are actually open to anything.
Yes?
The good thing that you are getting your diploma here is that you can go anywhere in Europe or around the world, basically in Europe mostly, because this diploma is recognized in European Union, so you can work everywhere directly, and also to do postgraduate studies as well. They will accept you for sure. You apply and they will accept you. I know from other students as well. That's why I'm telling. It's important, I think, yes.
Yeah, this is what you
Yes,
expect
yes,
after you graduate.
yes,
Yeah. But
exactly.
thank you a lot for your participation.
Welcome.
Yes, if you want to apply to any Bulgarian university, feel free to contact Inter HECS Study in Bulgaria. And of course, you're welcome to meet our team in the following months in London, Berlin, Manchester, and Birmingham.